So I talked a lot about colon cancer, colorectal cancer, and gastric cancer. So there is one other kind of entity that I think really benefits from cytoreduction in Hipec, and that's what we call low-grade appendiceal mucinous neoplasms. So oftentimes this is different from appendix cancer. Appendix cancer, although not quite the same, not really the same as colon cancer, is often treated similarly to colon cancer. But in the name, you notice that this isn't a carcinoma, this isn't a cancer, this was just a neoplasm. So these are known for making a lot of mucin and causing a lot of kind of gelatinous buildup of mucin in the abdomen. But you can tell because it's not a cancer, it doesn't have a propensity to spread or go to other organs. And it's also very low grade, meaning it doesn't divide fast. It actually divides very slowly, and it kind of is, it just sort of grows and pushes over time and can certainly cause symptoms because of the buildup of that mucin. But these patients, I think, are really good candidates generally for cytoreduction in Hipec. This is from Sugar Baker. He published this, and what I'm going to highlight here is this, the x-axis here is in years. So a lot of the earlier ones were months or maybe like going up to 3, 4, 5 years, but this is going all the way up to 35 years, and you have really long-term survivors, 10, 20 years. Most patients are still surviving after cytoreduction in Hipec for this. And that's just because it's a low-grade kind of non-aggressive disease that doesn't really respond to chemotherapy because the cells aren't dividing fast. So chemotherapy doesn't really affect it, but can be really addressed with surgery and can have really good long-term survival and outcomes. So that was one other thing I just wanted to mention in terms of the indications for cytoreduction in Hipec.